Welcome to the Drilling Millions podcast, presented by Sage Dental Partners.
Why you built a business in dental, some of the challenges with building a business in dental that's not direct patient care, and if anything could be learned from Invisalign or any of these other really great technologies, that is that, you know, sometimes the technology part is the easy part and the hard part's actually getting the dentist to buy in. So what's your experience in that?
Yeah, so I think for us, as we started in the space, like any new technology, first, people say, okay, why is it really needed? Well, I'm doing my job okay. If it's the more innovative it is, the more it's not that obvious that I would want to use it. So I think that was our earlier reaction when we started. It's like, okay, the first few dentists we chatted with, they were like, okay, this looks good. I really don't need it, but I can see who'll need it, right? I can see my associate needs it, or this so and so needs it, etc. And that was very interesting that we realized that, hey, for us to sell this, although and if the dentist is the buyer, maybe it is for the associate, maybe it is for people that and this is where you can start from. And so we started selling. We started off with DSOs as our primary customer, and DSOs had a real pain point, which was you're getting a lot of dentists into these practices who are coming right out of school, and they require a lot of training, as well as they're not that confident in their own diagnosis and communication. So can this technology be used to supplement them to be more confident in their diagnosis and educate? So starting off with that, but then what they started realizing was, wait, like we can actually use it to actually improve how patient communication is happening. And that's for everyone. That's not for the new dentist, etc. Because any dentist can use it to better communicate with the patients. Because if a dentist needs to now go and mark up every X-ray and measure every bone level, etc., that's not possible. And if patients are better informed using that information, that helps them in treatment acceptance rates, that's really good for first for the patient, because they're getting the right care, but also for the practice, because these are treatments that are medically necessary, that should have happened, are not happening as well. So over time, it has evolved, and like the more and more use cases are coming out as well. People are utilizing it to communicate more effectively with insurance companies, because they can just take that data, print it out, and send it to the companies as well. They're also using it to do their morning huddles now, of utilizing that data to say, okay, what did we miss? What should we focus on? And just in general, to create more consistency across the different dental practices, to ensure which practices are doing well, which practices need more help, and how can they help them. So a lot of use cases have developed from the original development of the software as well.
Yeah, well, my initial thought was, man, this is a really good technology to train dental students with, because you should be screaming at the CDA and the ADA saying, use this as the dental, acceptance exam. Screw, putting keys in sockets and, how many sides does this have? It's just, can you beat the AI algorithm at detecting if there's caries there or not? Like, is your color sensing better than the AI? I feel like that's a way better use of it.
So the good thing is, we've just recently started engaging with dental schools. So, you'll start seeing this hopefully getting used in dental schools as well. And the schools are very excited about it.
Yeah, it's a great tool. And it's something that, if you have hundreds of or thousands of images in your database, you could just, at home say it's like an hour of training. Okay, maybe not an hour. I'm a dental student. I don't want an hour of training, but, say it's like 15 minutes. Like, you need to just, for 15 minutes, just, is that caries or not? Is that bone loss or not? Is that, a cyst or not? And just keep going through it. I feel like it's a fantastic training tool.
Every morning, this is what you do before you brush your teeth. No, I'm just kidding.
Yeah, no, please don't pitch that to my school. I'll know who to email.
Yeah, exactly.
So I mean, dentists are a very unique class of people. I've dealt with them for many years now, and I work with them day in and day out. How is it selling to dentists in particular? Like you said, like the ability to just show them rather than tell them. What are the unique aspects about selling to dentists that, may not exist in other industries?
I would say I actually really like dentists as a customer as well. And why is because they're also business owners usually. So, and I think that is very unique in the medical profession, where they understand what ROI is, and and if you can understand ROI, and if a product brings a lot of ROI, then it makes sense for them. And I think also I think the fact that, or what we discussed earlier, with them not fearing it, them and excited about utilizing new technologies, at least especially the dentists coming in recent grads, etc. Like they're very excited about new technologies, etc. There's some cool technology already that they utilize, so there so it's something that I think we haven't had. Sales isn't a challenge for us. It's like, how do you make the software better? How do you make sure that it's being used and it has less friction in the clinical workflow? Those are the things that we work on, and I would say the product does sell itself.
And how do you see, given your 30,000-foot view in the industry, how do you see dentistry changing? I know there's a big push towards digital dentistry. How do you see the whole landscape changing?
So I would say, even we're possible because of digital dentistry being an important piece of it, and the trend starting about like 15 years ago or so, right? So, once you had the analog x-rays and you didn't have practice management systems, Overjet could not have existed as well, right? Because you needed all the digital x-rays to train on, to learn from, etc. So you needed that to happen. And the good thing is that, when it is such a win, you can't stop it as well, right? Like when where the momentum is there, and for digital dentistry, now you don't want now nobody's going back to an analog x-ray. Now you've been exposed to digital x-ray. It doesn't make sense. The same way as now as more and more people start using scans or intraoral scans, going back to the manual way of scanning, or not scanning, just taking the impressions, it's pretty cumbersome, and so it'll take some time for the behavior change to happen, for these tools to become more integral part of the workflows. But once it happens, it really fundamentally changes stuff, right? Like especially when you're thinking about these milling a crown or creating crown in your practice, right? The same day dentistry. There's some like really exciting stuff that's coming, which also, or of course there are people utilizing it as well. But as we look at it, the whole industry, there's a lot more that needs to happen there, so that in the end, the patient experience improves. And I think just to keep that patient in mind, that's why people became dentists. That's why we're in this space. That's why insurance companies exist. That that we all exist to serve the patient and improve better oral health or create better oral health for them, and help improve these systems and processes, etc., such that they can receive the best care. So I think in the way we look at it is, all the technologies which are here to improve patient care and experience, that's the right trend, and those will stick and hopefully will become more used. And things that are just there because people are used to them, over time, they'll start to decrease as well.
So you mentioned DSOs, dental service organizations, or corporate dentistry. What sort of work are you guys doing with them? Because right now, it's fairly mature in the US, but it's just starting to get big in Canada. So explain to me how Overjet works with the DSOs.
Yeah, so in Canada as well, with your there's some large ones like Dental Corp and 123 Dentists, etc. Like if I think, at least from what I remember, dental market is like 1/10 of the US market. So the numbers that you guys are seeing is like, now in double digits, right? Penetration or percentage penetration for DSO. So that is a trend that's also very hard to stop now. And the trend is basically that it makes more sense for consolidation to happen, because with practices, multiple practices coming together or being put under one managerial organization, what happens is your costs can decrease, and your revenue can increase, especially when it comes to insurance companies, etc. So better reimbursements and decreased costs can allow you to have better margins, and that in the end, it's something that's going to increase. There's also dentists who were owning these practices getting older and older. That transition needs to happen as well. So at least in the US, I think there's no one body giving us the exact number, but anybody anywhere from 25 to 30% is a number that's being quoted nowadays in the penetration of DSOs as compared to all the practices that exist. So it's something that and when I started, people said it was like 20%, or it was like 15 to 20. So I think that there's a lot. This is growing fast, and it's something that it makes a lot of sense.
And when was that? When was that 15 to 20%?
It was around like 2018.
Yeah. They've certainly exploded. And at a certain point, it's going to become really hard to outcompete some of the DSOs. But in general, I have quite a bit of empathy towards them, because we've had on you mentioned 123. Our first episode was actually with the CEO of 123. On my old podcast, we had on the president of Dental Corp. So I've actually spoken to a lot of them personally, and they do get a bad rap, or they do get a bad rep, sometimes undeservingly so. But it's interesting to sort of see the progression of them, and kind of it's interesting to sort of predict where they'll sort of plateau, and where that sort of growth will sort of look like the legal industry, where it's kind of like 50-50, where there's still a good amount of mom and pop shops, but there's a lot of the big corporate lawyers. But taking it sort of back to the AI model, like I said, AI, me, potato, no knowledge of it. So how do you train this AI? Is it physically dentists, manually going in and saying, okay, this is caries, this is not caries, or this is bone loss, this is not bone loss? What does that process look like on the back end?
Yeah, but before I get to that, I'll just touch on your comment on DSOs as well. I think at least the way I look at it is, you had these managerial organizations started, and they started taking more, they started growing, and you didn't really have tools to understand how are my practices doing clinically. You had financial tools, so you could always look at QuickBooks and look at the financials and say, okay, is my production low? What's happening in my collections? What's happening in my costs? But you didn't have actually any tool to figure out, like, how's my clinical performance doing? Are the practices doing well or not? Is there over treatment? Is there under treatment? And the only way to do it was through chart audits. So, and chart audits are not scalable at all. So if you look at, a practice and you say, okay, what is feasible to do? You hire a dentist to look at some charts of, you can't look at every chart. And usually DSOs would have something like, okay, we'll look at 10 charts of every dentist every month. You still cannot find, that's not statistically significant. You might, get an image where it might, everything is okay, or you might get an image where it might look not okay at all. But I think it was something that I would say the DSOs really didn't have tools, and I think that's where I'm very excited about. By using Overjet technology, you can actually understand the clinical performance of a practice, and if you can understand the clinical performance, now as the owner of that DSO, you can actually make sure that you're doing the right thing. Because it's very hard to manage if you're talking about hundreds of practices, and making sure that every practice is doing the right thing. And even if one practice screws up, it looks bad on you, that's hard to do. But if you have the right tools so that you can actually have more standardization across the practices, you're making sure that the right clinical care is happening, you can actually, it's better for the patient, better for the practice, and better for the DSO as well. So I'm actually excited in terms of where we are and enabling, even if this, this is a trend that's going on, we do it in a way that's best for the patient too. Now to your second question of like, how do you train these AI models? The way it is exactly what you're explaining. There are a few ways of doing it, right? Like, and you have to choose yourself. So there's supervised learning and there's unsupervised learning, and there's or you can have the middle of it, like semi-supervised. But supervised learning would be what you mentioned, where you literally have, say in this case, an X-ray, and you basically ask a dentist to say, what do you see in that X-ray? So say if you wanted to teach the model what teeth are or what tooth numbers are, you would ask them to mark up every tooth and label it as, okay, this is tooth number 2, this is tooth number 4, or whatever scheme you want to mark that in, and then you use those images to train the models. And here what you're doing is feedback. So say if there was a tooth in the image and you predicted the same tooth, then that's great, and you're providing positive feedback. Say if you there was an implant and you said it was a tooth, then it says not really, and you're giving it feedback such that it's learning. So once you do that thousands of times, hundreds of thousands of times, millions of times, you've learned now every piece of it, where you're like, okay, here's a cavity, here's a tooth, here's bone levels. And that's one way of training the models, which is very, you can see it's very labor intensive, because sometimes what you would also do is not have one input. So teeth might be fine, but say if you're looking at caries lesions, you would want probably multiple inputs as well, because sometimes a dentist might say there's nothing, another dentist might say there's something. Now what do you think is really there? Like, you want probably another dentist to come in, and how do you actually deal with that variance? And those are techniques on how do you deal with that, but you can actually learn from multiple dentists on the same image as well. So the model gets better over time, and that's but then there are techniques of how do you say if you've learned it on some images, or say you've learned what for like primary teeth look like, you can take those images and use like transfer learning, something like that, where you don't have to train every other model, but you can use the basics of that to train another condition which it hasn't seen. So like, say if you've done all bite wings and you wanted to do PAs, there's a lot of things that you can learn from the bite wing and apply it to the PA as well. But of course for PAs you'll probably want to put some more information there. So there's some interesting stuff you can do there, but also there's like other ways of like really like learning from from the practice management system itself and other things too.